Let's talk a little bit to Dr. Martin. Scott, this is a foot.
That is.
Minus the soft tissues. Dr. Moyer just mentioned the difference, or hinted at the difference between hind foot, midfoot, and forefoot.
That's right.
You have specialty training.
I do.
Right. You're not your average Joe.
I appreciate that.
So please explain to us, using this model, so that the patients, that potential future patients that are viewing public really have a good understanding that this complicated machine really just cannot be traded only by changing shoe wear, although we will address that point. So let's zoom in on this foot and ankle model and share with us the type of things that you bring to this illustrious practice.
So one thing you notice right off the bat is the number of bones in the foot. And so 26 bones in the foot. They all have their own ailments that patients deal with on a regular basis, especially people who spend a lot of time on their feet. In podiatry world, there's forefoot surgery, then rear foot surgery. So rear foot surgery is back from the midfoot back to the heel, and then you get into ankle surgery.
The ankle being the
joint
above.
Here above, where the foot bends the foot up and down. Forefoot surgery involves more of the joints of the toes, as well as the bones that go to the toes within the arch. When you get back to the rear foot, it does get a little bit more complicated. The rear foot sort of dictates and sort of tells the forefoot what to do. There's a lot of arthritic conditions that come in the back of the foot. There's a lot of other common ailments that patients have, such as heel pain, that can get complicated depending on what is causing the pain, which is part of the workup that we provide at the office. A lot of the surgeries involved with the forefoot and rear foot carry different treatments, as well as a lot of the conservative treatments.
By conservative, you mean non-surgical treatments?
Non-surgical, yes, sir. Non-surgical treatments, to where there's a lot of things we can get into a little bit later that involve boot immobilization, where you see people walking around in big Velcro boots that basically give the joints a break and allow inflammation and pain in the joints to ease. And then there's obviously medicines that help with joint pain that we can prescribe, as well as there's also physical therapy falls in the realm of what we call conservative treatment or non-surgical treatment.
So your emphasis, like most people that we bring on this show, your emphasis is non-surgical treatment.
That's right. And so usually your typical surgeon for rear foot, especially rear foot and ankle issues, and also forefoot issues, is you want to try everything you can to avoid surgery, because all surgeries come with their own recovery times and risks of surgery and healing time and downtime out of work. And so with conservative treatments, you can get people back to work, keep them in work, and avoid having to go through a costly surgery, and you sort of leave surgery as the last resort if all other treatments have failed.
Exactly right, and that's true for almost everything that we do.